the field hospital that you'll see when you get out there. If that doesn't work, they'll land up here and you'll still get to come up here and talk to them and learn what it's like to do emergency flight.
Question? Yep, Lori, you've got the observers, yes? Stanley Hansen?
The observers that are back here in this huge center.
So after Dr. France gives us our mission briefing, and I see that he's arrived. Dr. France, if you want to come up here. He's going to give us our mission briefing. After he gives us our mission briefing, you should have somewhere around 15 minutes with your team to do what we call just-in-time training. So how many people feel uncertain about what they're going to be asked to do today? I should see most hands raised. By the way, that's as real as it comes, okay? So in exercises that I've done in public health, we all show up and we get told this is your job. And then the station leaders, whatever those stations are, they're our chain of command, and their job is to tell us, to teach us what we need to do our job. And the term for that is just-in-time training. And what you're getting right now is part of your just-in-time training. This is the mission brief. This is why we're all here. And then you will have time with your groups to go out and check out where you're going to be working and set it up. Your responsibility actually is to set up your spaces and figure out and learn what you're going to be doing just in time, okay? This is as real as it gets. This is how we do it in the real world. Nobody really knows when they show up for a deployment what actually they're going to have to do, okay? So if you're feeling uncertain right now, welcome to the group, because that's how we all are supposed to feel. And by the end of the day, I hope you feel really confident about what you've done and what you've learned. All right, so with that, I'm going to pass the megaphone to Colonel France. Here's your team, ready for deployment.
Test.
Can everybody hear me? Yes. Welcome to Forward Camp Game Haven. All of you have come from all over the nation and several allied countries. As you know, we're in the midst of a major international crisis. As per what happens in the world, last year we thought we had the Haddad outbreak completely solved. But as you know, over the last several months, Haddad has reared its head again, and we're in the midst of a major international crisis that affects all of us. The world economy is affected by this. The glue that holds society together is affected by this. Just as we're meeting today, over the world, there's numerous groups just like yourselves that have volunteered to come forward and deploy to help handle the crisis. In introduction, myself, I'm Colonel Walt Franz, representing some members of the United States military that are deployed here. We have members again of the military. You have civilians from a number of medical centers. We have you wonderful volunteers that are out here. To give you just a very basic rules of engagement of what we're trying to do today, you met Dr. Malala. Secretary General Ashok Patel, is he here right now? Yes. Secretary General Patel is the overall commander of all operations here. And Dr. Malala is the overall clinical commander of all med ops, okay? So this is a truly a remarkable example of how a number of different groups can come together to confront a terrible issue going on. Some of you will hear the term zombie. It's been popularized in the press. We don't like to use that term because it's prejudicial. These are sick people, all right? So using the term Haddad is good for everybody, all right? What does Haddad stand for? hemorrhagic acral dermatitis, and anesthetic delirium. All right? Okay, I'm going to use the term zombie. It describes what zombies do. But our job is not to label people, it's to treat them. As you know, though, the Haddad crisis has gone from small groups of individuals who are infected by a disease to mass breakdown of society's response to these individuals, and the fact that when Haddad patients get ill enough, they create mayhem. That's part of the anesthetic delirium. They don't feel anything while they are delirious, and trauma can occur to others, and all types of issues can happen. As you know, and it's a fact of life that we have to deal with, there are groups all over the world that say, why don't we put these patients in camps? We need to arrest them. Our job here is to treat these patients with respect, take care of them, and we turn to our experts, Secretary General Patel, Dr. Malala, and Colonel Zavaleta. You want to raise your hand, please? Colonel Zavaleta can help you with specific protocols, all right? Specific protocols. Our major rule of engagement is, again, take care of these people, all right? And don't hesitate to ask questions if you don't know. What you will find as you're assigned to different areas of your camp, you will find registration areas for our patients. You'll find triage and sorting, where we say who needs the most care when. You'll find first aid areas. I am going to primarily be focused on some of the more intensive medical care. If my military colleagues want to raise their hands back in the back, they'll be helping back in the treatment area. We have chief medical officers, we have nurses, we have respiratory therapists. You're going to be coming across a number of medical people that are going to provide you with assistance in taking care of your casualties. All right? Very important on the rules of engagement medically is take care of yourselves. So one of the primary things at the top is, unless you're taking care of yourself and the person next to you, so we all want you to have a battle buddy, unless you take care of your colleagues, we can't take care of the Haddad casualties. Because if you become a casualty, then we got double trouble. So the main thing out here, if you would get bit by a Haddad patient, if you'd be injured by a Haddad patient,